last week. And he told me his story. 4 years ago, his wife, Jan, who happens to be a nurse, was struck with cancer. And she had to stop working. And then halfway through her chemo, her employer dropped coverage for both of them. And Alan's self-employed. He's got an antique business. So he had to make sure his wife had coverage, obviously in the middle of cancer treatments, so he went without insurance. Now, the great news is today, Jan is cancer-free. She's on Medicare. But Alan's been uninsured ever since, until last week, when he sat down at a computer, and I'm sure after multiple tries, signed up for a new plan under the Affordable Care Act. Coverage that can never be taken away if he gets sick. So, I just want to read you what he said in this letter. He says, I got to tell you, I've never been so happy to pay a bill in my entire life. When you don't have insurance at my age, it can really feel like a time bomb waiting to go off. The sense of relief from knowing I can live out my days longer and healthier, that's just a tremendous weight off my shoulders. So 2 days later, Alan goes over to his buddy Bill's house. He sits Bill down and his wife Diana at their computer. And after several tries, Alan helped lift that weight from their shoulders by helping them to sign up for a new plan also. And compared to their current plan, it costs less than half as much and covers more. See, that's why we committed ourselves to this cause. For Alan and Jan, for Bill, Diana, for Annie, for anyone who wrote letters and shared stories and knocked on doors, because they believed what could happen here in Massachusetts could happen all across the country. And for them and for you, we are going to see this through. We're going to see this through. We are going to see this through. This hall is home to some of the earliest debates over the nature of our government, the appropriate size, the appropriate role of our government. And those debates continue today, and that's healthy. There are debates about the role of the individual and society and our rugged individualism and our sense of self-reliance, our devotion to the kind of freedoms whose first shot rang out not far from here. But they are also debates tempered by a recognition that we're all in this together. And that when hardship strikes, and it could strike any of us at any moment, we're there for one another. And that as a country, we can accomplish great things that we can't accomplish alone. We believe that. We believe that. And those sentiments are expressed in a painting right here in this very hall. Liberty and union, now and forever. One and inseparable. That's the value statement Deval was talking about. That's what healthcare reform is about. That's what America's about. We are in this together, and we are going to see it through. Thank you. God bless you. God bless the United States of America.
President Obama at Faneuil Hall in Boston, Massachusetts, wrapping up a robust defense of the Affordable Care Act. I want to bring back CNN chief political analyst Gloria Borger and CNN chief medical correspondent Dr. Sanjay Gupta. Sanjay, we heard a revision of if you like your health plan, you can keep your health plan. It's now if you lose your health plan, you can go to one of the exchanges and find another one.
That's right. So there was a little revision in that language, and obviously addressing a criticism that we've been hearing throughout the day, the last few days. There was another little revision as well, Jake. You may have caught this, but he said, if you like your health care plan and it is working, you can keep it. So it's the "and it is working" language that he added in there as well. And what he was referring to is this idea that it is working to him means that it's offering these patient protections. You can't have your premiums raised. The caps on how much insurance companies can pay out go away. So, yeah, a couple of tweaks in the language there, but again, addressing some important criticism.
And Gloria Borger, we heard President Obama acknowledge very candidly that the website's not working. He's not happy about it.
Yeah.
But when it came to defending the actual plan, he talked mainly about the people who were sick, who were grateful for Obamacare, and not those people with concerns.
Yeah, he also, I might add, Jake, said that he took full responsibility for making sure that the website gets fixed ASAP. So he sort of put it on the line there. Now, I'm going to make sure it gets fixed. What's interesting to me is, building on what Sanjay said, he seemed to be saying, look, the insurers who are canceling your insurance were promoting substandard products. And we're not going to do that anymore. So understand that you can replace what was substandard with something that is going to be better. Now, he also said most people will get a better deal. And that's where the crunch is going to come, because a lot of people who are complaining are saying, okay, I want to replace it, but I'm not getting a better deal. And he's saying the deal that you will get will be better because it will be safer and more secure for you in the future.
Right. And of course, most people getting a better deal is not everyone getting a better deal.
Right.
And there's math here at stake, and some people are going to pay more. We got to get a break in. Thank you so much, Gloria Borger and Dr. Sanjay Gupta. Coming up next, with a nickname like Rombo and a reputation for swearing like a pirate, former White House Chief of Staff Rahm Emanuel is not a man known for beating around the bush. I will ask the Chicago mayor if he thinks heads should roll over Obamacare's botched opening. Stay right there.